People all throughout the world have high blood pressure. There are numerous symptoms and indicators of high blood pressure that you should be aware of. Let's speak about 9 symptoms of high blood pressure that you should never overlook. It affects 1 in 4 men and 1 in 5 women. Have you experienced aches in your chest? How about excruciating headaches? Does it appear like you urinate frequently? Wait, could my high blood pressure actually be causing me to lose my vision? We're discussing all of this and more. Starting with the most common cause of eyesight loss, elevated blood pressure. This may manifest as total loss of eyesight or as blurriness. There are numerous events that lead to this. High blood pressure causes a condition known as hypersensitivity retinopathy, which is the impairment of blood vessels to the point that vision becomes blurry. Research has indicated that those with elevated blood pressure have a higher probability of developing mild to severe retinopathy over time. Additionally, there is a condition known as choroidopathy, which causes an accumulation of fluid beneath the retina. If you lose your vision, or even just one eye, this makes it impossible for you to see. Do all in your power to see a doctor very away. Have you ever had unexpected eyesight loss? Why did that happen? Launch a discussion with your best friend by posting a comment in the space provided. Memory of community number 2. Loss of memory. Loss of eyesight. High blood pressure can also impair your memory because it reduces blood flow to the brain. Studies have shown that people with hypertension have less blood flow in memory-related areas of the brain. Your brain needs a certain amount of blood to flow through it. Roughly a quart every minute, give or take, because the blood isn't flowing properly. The brain doesn't get enough oxygen. As a result, you'll notice a decline in your memory. That starts to become fuzzy and eventually becomes fully cognitively impaired. Therefore, if you're concerned, make sure you get medical attention. Inflamed legs, foot, and stomach. 3. Enlarged legs, feet, and abdomen. If you have high blood pressure, you may have seen swelling in your lower body. This is a condition known as edema. An abnormal accumulation of fluid in the legs, feet, and ankles is known as edema. One indicator of pulmonary hypertension is elevated blood pressure in the lungs, which damages the pulmonary arteries that carry blood from the heart to the lungs. The arteries narrow due to hypertension, making the heart work harder to pump blood. As a result, the heart begins pumping blood from other parts of the body, including the legs. Your feet and legs will begin to swell, and you'll notice it nearly immediately. Your stomach will also begin to enlarge. Number 4. Chest pains. To put it simply, if your heart is working harder than it should to pump blood, your chest will become too weak to support the blood. This condition is known as angina, and it is brought on by reduced oxygen and blood flow. Eventually, the damage done to your arteries will result in a heart attack, so if the pain gets worse, you should get medical help as soon as possible. Usually, the pains are accompanied by other symptoms like sweating, numbness, shortness of breath, nausea, and vomiting. It's important to monitor your blood pressure. 5. Frequent urination. Hypertension not only damages your heart but also your kidneys. You may be noticing that you're going to the bathroom more often than usual. If this occurs at night, it's called nocturia, and it's likely due to your blood pressure being through the roof. Studies have indicated that those with excessive salt intake are more susceptible to developing nocturia. This is because eating a lot of salt raises blood pressure, and other research has indicated that using the restroom at night has a 40% probability of being linked to nocturia. High blood pressure also narrows the arteries surrounding the kidneys, which reduces blood flow to the kidney tissue and obviously disrupts normal kidney function. Hematuria is another issue with urine. Blood in the urine is a common occurrence in individuals with big kidneys and high blood pressure. Before we go any further, if you want to lose weight, you need to watch what you consume. Watch our latest video to learn about 9 food combinations that are good for your health right now. Returning to our previous examination of the 6th dangerous indication of high blood pressure, there are many reasons why you could have a headache, such as not getting enough sleep or eating a healthy meal. However, if you have hypertension, you should be concerned because a headache can indicate that your blood pressure is only going to get worse. Interestingly, headaches can sometimes be accompanied by nosebleeds, which typically occur when your blood pressure is measured at 180/120 mmHg or higher. If you notice that your head is pounding in addition to nosebleeds and general sickness, you should seek medical attention as soon as possible. Number 7. Abdominal pain. High abdominal pain. High blood pressure can cause the aorta, the abdominal artery, to bulge out. This condition is known as an abdominal aortic aneurysm. If you experience pain in your midsection followed by a firm bulging, you should seek medical attention right away because there is a 20% chance that the aneurysm will burst and you will die. Abdominal pain often comes with other symptoms. You should be especially concerned if you also experience deep back pain or a pulsating sensation around your belly button. Finally, abdominal pain might cause a loss of consciousness, so proceed with caution if you get a tearing sensation in the bottom left area of your body. 8th. Tiredness. Elevated blood pressure. You will feel extremely exhausted due to fatigue. Pressure and inadequate sleep will lead to further symptoms including headaches and cognitive deterioration. Even if your fatigue isn't directly related to high blood pressure, hypertension can still cause conditions that will leave you feeling extremely exhausted. As we previously discussed, high blood pressure damages the heart and kidneys, which can leave you feeling completely exhausted. Because your arteries aren't receiving the proper blood flow, you won't feel as energetic, which will interfere with your daily activities. If you find that you are becoming more and more exhausted over time, it's best to see a doctor because it can lead to other horrible conditions. Number 9. Heartbeat irregularities. Erratic cardiac rhythm. High blood pressure throws off the natural rhythm of your heartbeat, which is known as arrhythmia. If your heart is having trouble pumping blood, it will disrupt this rhythm. Heart failure is the result of a blocked artery that prevents blood from entering the heart, which causes a disruption in heart rhythm. If you notice that your heart is beating irregularly, you should seek medical attention right away as heart disease generally increases the risk of arrhythmia. This is the point at which it causes conditions like heart attacks and strokes. Your blood pressure can be frightening, and you really don't want to experience any of those symptoms. I know I don't, but how about we discuss strategies for preventing hypertension and maintaining the health of our hearts? Watch our video on 5 different food kinds that can help lower blood pressure, or look at 8 things that are now raising blood pressure quickly. Either way, pick one of the films on the screen to help stabilize your blood pressure. Please let us know if you have encountered any of these symptoms in the comments section below.